going to share my screen here. Okay. Can you guys see the screen?
Yep, we can see it on our end.
Awesome. All right. So my name's Jason Way. I'm a PGY4 at Casa Colina Hospital. I'm this year's chief resident. I first off want to thank PM&R Scholars for hosting this. This is such a great idea given all the weirdness with COVID. So thank you for hosting this. This is a great resource for this year's students. So I'll start off and talk about our hospital. Casa Colina Hospital is in Southern California in Pomona. We're in the Inland Empire. This picture is the entrance to our campus. We sit on 20 acres in Pomona. We're the largest standalone rehab hospital in Inland Empire. We have a 68-bed rehab unit, 25-bed med-surg, and 7-bed ICU wing. We also have inpatient, outpatient surgical centers, 6-bed pre-op, 6-bed post-op. We also have the imaging center in-house with MRI, CT, fluoroscopy, all that. We also have an outpatient Azusa center where people can do rehab in the Azusa. We have an on-campus long-term stay center called TLC, and also associated homes where the patients' families can stay as they stay at TLC. And we also have another long-term care center in Apple Valley. So our program is ACGME accredited. We're associated with OptiWest, which is also Western U. So we have an association with Western U, which is just down the street. We are an advanced program, which means that we are 3 years. So you'll do your intern year somewhere else and then spend 3 years with us. We have 3 residents per year for a total of 9. And last year we got a little over 300 applicants, and we're expecting more this year because of COVID. There are no other medical residencies in the hospital. There are neuro residencies for the PT and OT programs, but no other medical residencies. So you're not competing for any procedures. And the faculty to resident ratio is 1-to-1 while you're on inpatient. Our home site is Casa Colina Hospital, but we do rotate at other sites. We rotate at Children's Hospital LA with the UCLA residents, Synovation Medical Group for interventional pain, Pasadena Center for neuromuscular medicine for neuromuscular rotation. We do our EMGs on site at the hospital and outpatient, as well as inpatient, as well as with the neurology group. And we do a rotation with Gary Orthopedics as well for musculoskeletal sports medicine. We're a feeder hospital, or we take patients from surrounding hospitals, including Pomona Valley, San Antonio Regional, Arrowhead Regional, Chino Valley, but also out from the Desert Regional, Eisenhower, some from the Kaiser systems and the surrounding SNFs, and also some from out of state as well. So our core faculty is made up of Dr. Phillips. He's our program director. He did PM&R at UC Irvine. He was also rehab director at Presbyterian in Hollywood. And so he's a master in compliance. Dr. Patterson also did PM&R at UC Irvine. He's also boarded in traumatic brain injury. He also has eidetic memory, so he's a complete wealth of knowledge and really fabulous in neuropharmacology. Dr. Huang did his PM&R at UPMC. He is probably the best physiatrist I know, combines both physical medicine and rehab. So when you rotate with him, you really rack up the numbers with procedures because he's not afraid to do injections while in inpatient to help his patients get better scores. We also have Dr. Sangnil. She's new to our hospital. She joined us a little over a year ago. Dr. Burton, who's in the group, is currently rotating with her. She's from Case Western. She does mostly rehab, and she also does EMGs. Those of you from Western University may recognize Dr. Frey. He does PM&R at UC Davis and a neuromuscular fellowship as well. And we see his patients on outpatient. He also runs our OMM clinic, and we also do EMGs with him. Like I mentioned, we rotate at CHLA for pediatric rehab with Dr. Craig. If you're interested in pediatric rehab, this is a fabulous place to rotate. If you're thinking of any pathology with pediatrics, you'll likely see it on this rotation in your 2 months. They really get a lot of crazy pathology there. We do interventional pain with Dr. Lynch. He's the medical director of Synovation Medical Group. He trained at Loma Linda in anesthesia. He does axial injections, peripheral injections, opioid management, pump, and stim management, as well as you also get a chance to scrub in on the spinal cord stim as well as the pump implantation and explantations. We're also currently setting up a rotation with Dr. Murati and Dr. Patel. They're both graduates from Furman, OSS Health. Furman was one of the authors of one of the big books that a lot of people use. There's sports and spine practice. And they also do some regenerative biologics. Like I mentioned, we rotate with Dr. Patel for musculoskeletal sports medicine. He's a surgeon, orthopedic surgeon by trade, but he also did a sports medicine fellowship. I'm currently on that rotation. I'm having a lot of fun with him. We do a neuromuscular rotation with Dr. Yegiayan in Pasadena. She trained at Mayo Clinic. You see a lot of neuromuscular pathology there. A lot of POTS, orthostasis, myasthenia gravis. You'll even see ALS, muscular dystrophy, the whole gamut. To get our numbers, we rotate with the neurology group to do EMGs with Dr. Altamimi and Dr. Kazi, who are both did fellows in neurophysiology. We currently get probably 250, 260 EMGs, depending on how aggressive. You probably could get more if you really want to get more numbers, but on average, probably around 250. So you don't have to worry about not getting those numbers. We get prosthetics and orthotics exposure with Lance Clausen with J&K Orthopedics. He's across the street from our hospital. That's while you're on outpatient rotations. And it's really hands-on. He lets us help him build some of the orthotics. And here we're doing casting for like braces to get a mold of your arm. Notably, I sent this picture to my wife along with a Google picture of a radial fracture. And we had a good laugh until she called me about 2 minutes later, all freaked out. Yeah, so we know how to have fun. We also have wound care and hyperbarics exposure. We have a hyperbaric center on campus with Dr. Gott. He's an infectious disease specialist, so it's really nice to curbside consult him. But we also do a rotation with him. While you're on TLC, you spend Monday mornings. He has a wound care clinic, and we also watch him put patients in the hyperbaric chambers, and we learned a little bit about that. We also have a transitional living center rotation. That's our on-campus long-term stay. It's mostly TBI patients and some spinal cord injury and stroke patients. These are patients who are too well to stay in the hospital, but not well enough to go home. So it's quite an interesting patient population, and we follow the patients of Dr. Patterson, Phillips, and Huang there. We are a community hospital, so we do have a lot of community consultants. This is a main list of the consultants we work with within the hospital, so we have quite a few people that we can choose from. This is a sample rotation schedule. We're pretty flexible on the later years, PGY3, PGY4, but you can see it's front-loaded with inpatient during your PGY2 year, and then a little bit lighter, your PGY3 and 4 year. More outpatient, notably your PEDS rotation is your PGY3 year. We want to make sure you have enough inpatient before you go to PEDS. But this is an example, it's color-coded so you can look at it. A typical day while you're rotating on inpatient with one of the attendings, you'll get there around 7, you'll pre-round on your patients, the attending will show up around 8 or 9. You'll round with them, and then they'll head on to outpatient, but they're always available. You'll spend 3 to 4 hours with each attending per day. You carry about 10 patients on your census on average. It can go up to 14, but it generally sits around 10 patients. We get a lot of traumatic brain injury patients because Dr. Patterson, we get a lot of traumatic brain injury patients, a lot of stroke, good number of spinal cord injuries as well. The whole gamut, Asia, A through D, central cord, Brown's cord, all of those. A lot of neuro rehab as well. We work with City of Hope, so we get a lot of tumors from them, spinal cord tumors, brain tumors. Other neuro rehab, like Guillain-Barré is supposed to be rare, but we probably get 1 or 2 per month per service. Parkinson's, exacerbation, myasthenia gravis, Huntington's disease, all those. Of course, we get debility and ortho. They probably make up maybe 20, 25% of our census. In outpatient, You'll follow up on patients that you saw inpatient. We do a lot of spasticity management as well, concussion management. We do injections with and without ultrasound, EMGs as well. We do OMM clinics on Wednesday mornings, although that's currently on hold because of COVID. Like I mentioned, on Fridays, you head over to J&K Orthopedics and you cast yourself to scare your wife. You also learn about workers' comp. We have a lot of workers' comp cases. So if you're interested in medical legal, we have a lot of those. And you also learn a lot about billing as well, since we are a community hospital. We have gate rounds as well every 2 weeks, which is also currently on hold because of COVID. But when it is going, we bring in patients of interest that we think we could benefit from having multiple eyes on. We bring in all the residents, we bring in the attendings, our orthoticists, Lance, also all the therapists, and we watch them walk back and forth, and we see what we can do to try to optimize their gait patterns. It's pretty interesting. It's a lot of fun to figure out each patient, because each patient is a different puzzle. Friday mornings, we have protected time for didactics. It's typically a guest attending or a resident that's speaking. We also host EMG or ultrasound workshops as well. We also have lectures throughout the week. It's usually during lunchtime. Just add in a little bit of extra education. We do board review weekly. We do journal club every 2 weeks. And we also work with Western U to go into their cadaver lab. That's also currently on hold because of COVID, unfortunately. The call schedule, it's front loaded as well. PGY2s have 8 weeks, PGY3 have 6 weeks, and PGY4s have 4 weeks. It's a home call. You're on call from 7 a.m. on Monday to the next Monday, 7 a.m. On the weekends, you come in and do admissions. And while you're at home, you also take calls, not only from the hospital, but also from TLC. You don't have to stay in within the hospital because we do have a nocturnalist. So they'll handle critical issues. So most of the time you don't have to go in. I'd say maybe once or twice a year you have to go into the hospital for something abnormal, but otherwise you're okay to just handle it over the phone. And an attending is always available. If you have any questions, you could always text or call one of the attendings, and they're always happy to help. Our vacation is pretty standard, 20 days of PTO, and then you have on top of that federal holidays, and then we have 3 sick days available. The hospital also covers your medical license and DEA. And if you need to work around things, we're pretty flexible with conferences and those sort of things. If you're interested in research, we have a research institute that's funded by our Castellino Foundation. We have 3 UCLA PhDs as well as support staff, and they're a great resource. They have a lot of projects going on, and if you have any new projects you want to start, they're happy to help out. We also have IRB associated with them. And speaking of which, there's also a lot of hospital communities. If you're interested in what goes on in managing a hospital, there's a lot of committees that we can participate in to see what goes on behind the doors. If you're interested in sports, we do sports physicals for the surrounding high schools. There's also sports coverage for Ontario Fury. They're an indoor soccer team, a professional indoor soccer team. And we act as the team doctors at their games. So we show up and watch the games, and if anything happens, we go and check on the players. There's also Land Meets Sea. This is an event that Castellino Hospital sponsors every year. Unfortunately, it was, again, canceled this year because of COVID, but it's 3 days out in Long Beach. And we have patients come down and participate in water skiing and rock climbing and wheelchair rugby, which they call murder ball, wheelchair hockey, hand cycling. And then the residents take a day off. We all go down there, and we don't act as doctors. We participate and just experience everything. It's really, really great. It was unfortunate that it was canceled this year, though. So these are just some pictures of our didactics. This is our program director sampling one of their wheelchairs. This is electromyography for the powered prosthetics, computer-controlled powered prosthetics. This is a virtual Botox injection practice with a VR set. There's hand therapy, dipping our hands in wax. There's also some hand therapy, fluidotherapy. That's Dr. Burton on the left. And then, like I mentioned, we cover for Ontario Fury. So this is the stadium. The mascot happened to sit right in front of us. I was playing around with those two ladies. This is Land Meet C. We're out in Long Beach. This is a paraplegic doing water skiing. This is Murder Ball. Notably,
5 minutes left. You got 5 minutes.
5 minutes. Okay, thanks. There's kayaking as well. And we also have things outside of medicine. We participate in the Halloween skits with the therapists. This is some of our residents as Aladdin and Jafar. There's also galas that we participate in, and our hospital holds. This is a Christmas party where our CEO gets a little crazy with giving out cash. Dr. Phillips is a big Dodgers fan, so we've gone out to games with him. I do archery, so I brought some residents out there. And we also hang out in downtown LA because it's right there. This is one of the rooftop bars. This is the image at night. So we have like a good family culture. We all support each other. We have lunch with our attendings every lunchtime when it's not COVID. We're all friends outside of the hospital as well, so we all hang out. We normally have regular game nights and happy hours when there isn't COVID. Karthik, our chief last year, kept trying to get us to go axe throwing, for example. So where do our residents end up? We are a new program, so we only have one class that graduated. Karthik ended up at Loma Linda in a neuromuscular medicine fellowship. Tom ended up at integrative physiatrist. He's doing general rehab at St. Mary's Hospital. And Zaire is doing a pain medicine fellowship with Synovation. And you can see our PGY4s. There's two of us that are interested in pain. I'm going to be going to UCLA Spine with Nikesh, who will speak with you guys later. Nico's waiting for the match to occur, and then Adam's going to do general physiatry. But you can see with our residents, there's a pretty good spread in interest, so we have a pretty good diverse group. So that's it that I have for you. If you have any questions, feel free to reach out to us. We do have an open house on September 14th. If you could take a picture of this, that link will link you to our Google Meet, where we'll be able to answer more questions and spend extended amount of time answering your questions if we can't answer them all today. So thank you for your time, and I'll open up to questions. Any questions? I see movement, but I don't hear anybody asking questions. Is it in the chat? Okay. What community health outreach opportunities are available through the program or in the area? What global health opportunities are available through the program? Community health outreach opportunities. Like I mentioned, there's those volunteer opportunities that we do the physicals, but we also have a sports medicine clinic on Sundays, which we participate in. Global health opportunities though.
I can also speak to, this is Dr. Block, by the way, I'm one of the residents here. Other community health outreach, we go to the LA Fair and do outreach there. And then there's also a free sports medicine clinic that we can get involved in on the weekends. And then there's also several programs through Casa Clina, including an outdoor adventures program, which you can participate with. That's a lot of outdoorsy type activities that we do with our patients. So there's definitely lots of opportunities for community involvement.
And the sports physicals you mentioned earlier that we do with Dr. Patel, the local high school teams, as well as Fury.
Next question, besides opportunities to serve on committees, could you expand upon the hospital leadership admin exposure? Well, we are a new program, so there's a lot of opportunities. Like if it really depends on how driven you are. Our program director is very supportive of us and open. He always has an open ear to us. If we have any ideas, we always approach him. We also have great support from our CEO. We used to do monthly lunches with him. Of course, with COVID, we're trying to minimize his exposure. But we have full support of the CEO as well. So if you have ideas, you could float them across the table to him. A lot of times he's game for them.
Yeah, I think that's very unique to our hospital in general, is how involved our CEO is with the hospital directly and also with the residency. I could arrange a meeting with him. Me personally, it wouldn't be that hard to do for I don't say any reason, but basically we have an ear of the CEO if we need it for any reason, aside from through our program director directly. He's just in meetings that we have, and for example, I'm involved with the committee now that I meet with him, as well as hospital administrators. And Jason was there last 2 months ago before me, twice a week. And we sit down with the administration of the hospital and the program, other physicians and hospital administrators. So we have a lot of direct interaction with those people on a daily basis.
All
If I
right.
could just add one more thing. It's not just that you're sitting on these committees and kind of listening. The committees are super responsive to having the resident physician involvement. They want you to speak up. They want you to take leadership, and they are very receptive to anything that you have to say, and any kind of initiative or any kind of program that you want to push. We'll both listen to you and then also provide support if needed to get what you want to get done, and to help you in your leadership and any administrative kind of interests that you have.
All right. Awesome job. If you guys want to continue to answer questions in the chat, you're welcome to do that. Also, if you want to add some contact information in the chat, if you haven't already given that out. But excellent presentation. Thank you for coming down. We really appreciate having you guys here. Next up, we're going to turn it over.